Okay, good afternoon, everyone. Welcome to Vincent's client webinar today. My name is Gemma Davidson. I'm the People and Culture Manager for Vincent's and have been working within HR for around 13 years. The subject that I want to talk to you about today is supporting and managing employees with mental health concerns and conditions within the workplace. We see major challenges around this, and certainly across my career I have, in particular around stigma. So I'm going to really focus on that as we work through the webinar. Happy to take questions at the end, so please feel free to type them in. First and foremost, I'm just going to put up our disclaimer slide, so I'll just give you sort of 20 seconds to have a read of that. Okay. So in terms of an agenda for today, guys, first and foremost, I'm going to talk to you about why mental health matters, what a mental health condition is, signs of a mental health concern in the workplace, so what type of behaviors or mood changes you might physically or otherwise see, obligations as employers, having a conversation if you suspect something isn't quite right. So I'll give you some tips around how to approach that with individuals in the workplace. What if someone doesn't want help? So what to do if someone is pushing back and saying that they don't want any help? Big question that I get asked a lot, can we performance manage someone with a mental health concern? And I'll talk you through how you might go about doing that. And lastly, where else can some people get assistance as well as their employer? Okay, so why does mental health matter? Well, around 1 million Australian adults have depression and over 2 million have anxiety. Mental illness costs the economy $28.6 billion a year, with suicide being the leading cause of death amongst young and middle-aged Australians. A sort of alarming figure in particular for this industry that I came across recently was that 33% of employees in the financial and insurance industry have experienced a mental health condition. Depression and anxiety can lead to huge impacts on both the individual, their teams, and of course the company in terms of absenteeism, lost productivity, and in some cases increases turnover. So employees actually just leave an organization if they don't feel supported. Mental health conditions can also impact on an individual's ability to form positive relationships at home, but also with their colleagues. It can make them unable to work productively in a team and of course achieve KPIs. What is a mental health condition? Well, the term describes a wide range of disorders that can affect an individual's mood, thinking, and behavior. Some conditions you might have heard of can include depression, anxiety, bipolar disorder, borderline personality disorder, obsessive compulsive disorder, eating disorders, and of course many others. But the most prominent mental health conditions that we do see in the workplace are depression and anxiety. Of course, workplace stress is also common and can be managed in a similar fashion, even though it may not be determined a condition. Each disorder, of course, varies in severity, and the disorder can vary in how it presents and how it impacts upon an individual from person to person. However, a key point is that it should be viewed and treated like an illness and not a weakness or a personal feeling. So like any other illness, it should be treated in that way. Many of these conditions are misunderstood. People can be guarded, of course, about discussing them for fear of being judged or written off. And that's a society issue as well as within the workplace. Some causes of mental health conditions. So causes can include family history of a mental health condition, personality factors, an ongoing stressful environment that can include a workplace, major life event, something even like having a baby, moving across, say, the country, moving internationally. Divorce can be another key one. Physical health problems can see someone actually have a mental health condition because of the strain of that, the stress of that. Other mental health conditions can actually manifest into some individual actually experiencing more than one. And of course, substance use or abuse, we can see mental health conditions develop around that. Remember though, key point, everyone is different. What might affect one person may not affect another person in the same way. This also goes for different times in someone's life. Something might affect them in a very different way a couple of years ago versus something going on in their life at the moment and affect them very differently. And for them to respond, they might well respond very differently. Why does stigma matter? Well, stigma against people who have a mental health condition is very common, and it can have long-term significant impact. Stigma can also prevent people from asking for help and getting the support that they need, therefore actually slowing down their recovery. So from a workplace perspective, that can mean that they don't come back to work as quick as they could have, or they don't get back to a place where they're actually being productive again as quick as they could have if they're not getting support and not getting help. Other people with a mental health condition are not treated the same as others, both inside and outside of work, and really that is what stigma is. This is, however, from a workplace perspective, discrimination and shouldn't be acceptable in any workplace. But education is really the key to help reduce stigma. So in a workplace, it's talking to leaders, it's talking to staff, it's removing the taboo around a mental health condition, meaning that someone just can't work. There are many people with mental health concerns or mental health conditions or someone going through something in their life that are able to still work very productively if you have mechanisms in place to support them. Specifically, what is depression and anxiety? Well, depression is a persistently low mood over a period of 2 weeks or more. There's usually a loss of interest in normal activities, and it may lead to a dramatic change in mood, sleep cycles, and appetite. Anxiety, well, everyone will experience stress or anxiety as a normal emotion, and that is a normal emotion. We shouldn't make it anything but a normal emotion. But anxiety becomes an issue when it doesn't go away. The person is unable to control it. Can make it hard for a person to function day to day. So it actually has a gripping impact on them day to day. And it often is accompanied by what is known as a panic or an anxiety attack, where someone can really struggle to breathe. Signs of a potential mental health concern. Well, physically, some of the things that you might see within your workplace, within your employees, is someone looking more tired than usual. So really try and wait back to what is usual for them, what is normal for them. Seemingly flat or lacking energy, eating more or less than usual, having a pattern of illness, headaches, or being run down, so their absenteeism will often increase, consuming more alcohol than they normally would, or even just more fidgety or nervous than you would normally see them. In terms of their mood, they may well be more irritable, or some may say snappy, than their normal state, appear overwhelmed with things that actually were previously manageable for them, quick to display anger, so quick to go to negativity, quick to get fired up, and reacting more emotionally than the situation deserves. Perhaps going over and over a situation when ordinarily they wouldn't have done that in the past, or it actually just doesn't warrant it. Now, some other signs of mental health concern at work from a behavioral perspective are that they may well be more withdrawn than usual, easily distracted or unable to focus, avoid social interactions with work colleagues, especially if they were very social previously. Could be a loss of interest in hobbies or activities. Again, eating more or less than usual. And of course, not meeting their deadlines or KPIs, in particular if that is a new behavior. From a thinking perspective, someone who is going through something significant and could even have a condition, a mental health condition, they might have the tendency to catastrophize, make something a lot bigger than it really needs to be. They might well personalize a situation, so make it about themselves and become quite focused on that. Show signs of paranoia, seem to interpret a situation negatively, so straight to the negative, straight to thinking it's something to do with them, rather than just actually looking at what has actually occurred. Having thoughts that actually sound irrational, or complaining about difficulty switching off their thoughts, or constantly rehashing a situation. So if you find someone is coming and talking to you again and again and again about a particular issue that's come up that you wouldn't have thought warranted it, you really need to be thinking, you know what, it's time to have a conversation. So generally speaking, a number of the sort of charities that I've worked with in the past and really focus on mental health say, if you notice 2 or more of these types of things happening, and it is outside the norm for that individual, it is time to really just be having a conversation. So employer obligations, we have a number of obligations as employers, but some of the key obligations are to, 1, avoid discrimination, ensure that people are not being discriminated against for a protected attribute. And mental health is a protected attribute. We have an obligation to workplace health and safety to ensure employees are in a safe working environment. We must ensure privacy by also just ensuring that we're giving support. So if someone is actually raising something that impacts upon their health and safety, then privacy can be overlooked, but we need to ensure that we're being as confidential as we can with the individual. And lastly, of course, we've got to abide by workplace law. And there are some significant laws around support for employees and avoiding discrimination. Now, if you do get into a situation where you've got an employee that's displaying some of these behaviors I've talked about, it's time to really think about having that conversation with them. I'm going to give you some tips around how you might actually approach that. So firstly, you need to plan the conversation. Too many employers will jump in, leaders will think, oh, I'll just have a chat, see how they're going. You really need to think about what that conversation is going to involve, set some time, get away into a private place, and make sure that you're giving them the space to be able to talk. So as I said, firstly, set a time up for the catch-up. Find somewhere private and quiet. Make sure you let them know it's a check-in to see how they're going. So you don't want to actually increase their anxiety, if it is anxiety that they're displaying, by being too vague about what you want to talk about. So just say, look, I really want to check in with you, see how you are. Before setting down for the meeting, have clear examples that you can provide along with a timeline. So it's no good saying, I've just noticed that you've been really down lately. You actually need to say, I noticed on this particular day, or I noticed yesterday that this happened and this is how you responded and it concerned me. Think about the sort of assistance that you are able to accommodate if necessary. So that could be things like, look, do you need some annual leave? Do you need some time out? Do you need to change your hours perhaps? Do you need some other support, which we can talk about soon in terms of a medical practitioner? But a key point, be ready to listen, but also understand that especially if it's the first conversation, they may not want the help initially, or it might be something that they really need to reflect on and go away. So step 2, when you're actually having the discussion. So sit down with the employee and explain that your reason for catching up is because you are concerned for them. Lead with concern. You're concerned about specifically some things that you're going to talk about, but you really are here to listen and hear what they've got to say and give them support. Acknowledge that the staff member might feel uncomfortable talking about mental health concerns, and assure them, actually say to them that you understand that a mental health issue or mental health concern, a mental health condition is like any other physical disease or illness, and you don't see it in any other way. Be clear on the purpose of the conversation. So define that key behavior observations that you've seen and talk about how it might be impacting on their work and their team. So you can even say, we've got people on the team that are really concerned about you. So they know that there are others that are sharing that concern. But avoid making a diagnosis or using labels. So don't say things like, you seem depressed. I think you have anxiety. I think you have a disorder. Just say things like, I've noticed you've been withdrawn from the team lately. I've noticed that you've been reacting, more negatively than you might have in the past. So actually just talk about the behaviors, don't label the person. Step 3, collaborate and develop some solutions. So ask the staff member first and foremost what might help support them at this time. So actually get them to reflect on what help they might like. Don't just go in right away with options. Get them to think about it because they might say something that you haven't even thought of. Then discuss with them other options available that they might not have mentioned. So think about what support you can actually give them and talk that through. Ask the staff member if they have sought help anywhere else. Encourage them to seek medical help if not, or to continue receiving medical assistance if they are. So usually if they're seeing a GP, they might be under a mental health plan, they might be seeing a psychologist outside of work, and really just encourage that to continue, or if not, encourage them to do so. If you have an employee assistance program, encourage them to use that. Now, usually that program will offer the individual to give them a call, set up a meeting to go and see a psychologist, and that is a private, confidential conversation. As an employer, we get no details around that other than an employee went, and we therefore pay. So really encourage them to use that service if you have it. And provide information on other services that may be available if necessary. So things like if you do have someone talking to you about a domestic violence situation, as an example, think about what type of local services or charities you can actually refer them to get some support. This is a key point, though. Document the meeting and put actionable items or workplace adjustments into a clear plan for both yourself and the staff member with a short-term review date. So agree on what's going to occur following the meeting, what steps they're going to be taking, any adjustments that you've taken, and then get a short-term review date in place. Okay, step 4, one of the most critical steps, follow up. So agree on a schedule for frequent follow-up meetings. So I would say at least fortnightly. If you can do it once a week, great, but at least fortnightly check in with an individual that you have been concerned about. Ensure you document the meeting, discuss what other options are available to them to support them that they may not have had before. So they might have said no to something like EAP in the past. Don't just hold back and not bring that up ever again. Make sure that you are reiterating that that service is available to them, because some people can come around to that idea and decide to use it. But key thing also, monitor their performance and provide them timely feedback. So if you do see an improvement in particular, make sure that you are reinforcing that to them, that you're giving them that praise so they can hear that it is being noticed, that there is a shift. What if the staff member doesn't want help? Look, I'm going to talk firstly from an employer perspective, but you need to ensure that you're making a record of the conversation to say that you certainly did reach out, you offered help, and you set in place review dates where you would have another conversation. Be sure to record any performance issues raised during the meeting. So in particular, if an employee is having an impact on other employees because of how they're behaving at work, even though that may be triggered by a mental health concern or a mental health condition, you still have a duty of care to those other employees. So make sure that you're recording those performance issues that might be coming up. And likewise, if it's a technical issue or not meeting deadlines, not meeting KPIs, even though it may be driven by a mental health condition or concern, you're still going to have to deal with that at some point. So make sure that you're recording to show that you took this approach first. You wanted to provide support. Set a time for review and follow up. So don't just let that go. If someone says, no, you know what, I'm fine. There's nothing wrong. I don't want to talk about it. Don't allow that to be the last time that you do talk about it. Or don't jump right into performance management if there are real concerns. Revisit the conversation if things haven't improved in particular. And again, I'd say a fortnight later. Don't leave it any later than that. And of course, if you do have HR within your organization, ensure that you're alerting them. And sometimes we might find it necessary to actually involve EAP. So as an example, I can say to you that prior to where I currently work, I had a situation where an individual was going through substance abuse issues, and we involved EAP and even that employee's family to provide support and try and actually deal with it, rather than just coming from an employer perspective and just going down the path of performance managing. Now, big question, can I performance manage someone with a mental health concern or condition? Look, short answer, yes, but there is a number of caveats. So first and foremost, reasonable expectations should be adjusted to account for their mental health condition. Reasonable adjustments must be made to assist in managing their condition. That can include things like changing hours of work, flexibility to work from home, or even just their workspace. They need someone a little bit more quieter. If you can accommodate, you should try, and you should show that you've tried. Sufficient time should also be given for the adjustments to take effect. So don't say, you know what, I've allowed you to work from home for 2 weeks or 2 Fridays, and so you should be better, you should be fine. Actually give it around 3 months to see the impact. Frequent meetings should be held leading up to any decision to enter performance management. And again, you should have those meetings documented. So show that you have you've had those conversations, you've really led with a concern, a supportive approach. And if they've either pushed back or they've tried, but it's still not improving, then you can be in a position where you can start to performance manage. If you have HR on board, then you should involve them to ensure that they are ensuring fairness to obviously all parties. So you as the employer and also the employee. Now, look, just as a final couple of slides, I do have a few websites on here really around organizations that I've worked pretty closely with in the past around mental health with employees. Beyond Blue is one of the most excellent organizations, Lifeline Sane, and this in particular last one is a suicide callback service. So for anyone who is feeling suicidal, they can call this number or send a message over their website, and they will call them back straight away. So there's no cost to those individuals. And look, our last slide, just a reminder of Vincent's and our services. So you can see we're a full service firm. And also just be aware that in terms of if you ever need any HR advice or support, we also have that facility available to clients. Okay, thank you so much. I really appreciate you coming on board and listening to the webinar today. I'll just have a look and see if there are any questions. So we've got Birgit Rainbird just asking, can we have a copy of the presentation? Yep, I'll certainly speak with marketing and we'll get that sent around. I'll just give it a few more seconds, see if anyone else has any questions. Otherwise, thank you and have a good rest of your Tuesday.